During the preparatory phase of the soccer penalty kick, the erector spinae is flexed 20 degrees in the sagittal plane by the agonist, the rectus abdominis, which is isometrically contracting. The synergists are the internal obliques, and the antagonist is the erector spinae. The left glenohumeral joint is abducting 90 degrees in the coronal plane by the agonist, the medial deltoid. The synergists are the posterior deltoid, and the antagonist is the anterior deltoid. The shoulder girdle is upwardly rotating by the middle trapezius, which is isometrically contracting. The trapezius is also elevating the scapula. Both humeral ulnar joints are extended 0 degrees in the sagittal plane by the triceps brachii. The synergists are the brachialis, and the antagonist is the biceps brachii. The right acetabulum femoral joint is extended 30 degrees in the sagittal plane by the agonist biceps femoris, which is isometrically contracting. The synergists are the gluteus maximus, and the antagonist is the vastus intermedius. The right tibiofemoral joint is flexed 150 degrees in the sagittal plane by the agonist, the biceps femoris. The synergists are the semitendinosus and the semimembranosus. The antagonist is the rectus femoris. The right tibiofemoral joint is plantar flexing 30 degrees in the sagittal plane by the agonist, the gastrocnemius. The synergist is the soleus, and the antagonist is the tibialis anterior. During the execution phase, the erector spinae is flexed 30 degrees in the sagittal plane by the rectus abdominis, which is concentrically contracting. The synergists are the internal obliques, and the antagonists are the erector spinae. The right glenohumeral joint is extended 60 degrees in the sagittal plane by the agonist, the posterior deltoid. The synergists are the latissimus dorsi, and the antagonist is the anterior deltoid. The shoulder girdle is downwardly rotating by the rhomboids, which are concentrically contracting. The scapula is adducting due to the middle trapezius, and the rhomboids in the coronal plane. The right acetabulum femoral joint is flexed 45 degrees in the sagittal plane by the sartorius. The synergist is the rectus femoris, and the antagonist is the biceps femoris. The right tibiofemoral joint is extended 0 degrees in the sagittal plane by the four quadriceps, the rectus femoris, vastus lateralis, vastus medius, and vastus intermedius. The synergist is the sartorius, and the antagonist is the biceps femoris. The right tibiofibular joint is plantar flex and everting 30 degrees in the sagittal plane by the gastrocnemius, and the synergist is the soleus, and the antagonist is the tibialis anterior. During the follow-through, the erector spinae is flexed 30 degrees in the sagittal plane by the rectus abdominis. The synergists are the internal obliques, and the antagonist is the erector spinae. The erector spinae is also rotating 30 degrees to the left in the transverse plane by the erector spinae. The synergists are the right external obliques, and the antagonists are the left external obliques. The shoulder girdle is adducting and downwardly rotating in the coronal and transverse plane by the rhomboids. The synergists are the trapezius, and the antagonist is the serratus anterior. The glenohumeral joint is extended 60 degrees in the sagittal plane by the posterior deltoids. The synergist is the latissimus dorsi, and the antagonist is the anterior deltoid. The humeral ulnar joint is extended 0 degrees in the sagittal plane by the triceps brachii. The synergist is the brachialis, and the antagonist is the biceps brachii. The right tibiofemoral joint is flexed 30 degrees in the sagittal plane by the sartorius. The synergist is the rectus femoris, and the antagonist is the biceps femoris. The right tibiofemoral joint is adducted 20 degrees in the coronal plane by the adductor group. The synergist is the pectineus, and the antagonist is the tensor fasciae latae. The left tibiofemoral joint is extended 30 degrees in the sagittal plane by the biceps femoris. The synergist is the gluteus maximus, and the antagonist is the vastus intermedius. The left tibiofemoral joint is adducting 20 degrees in the coronal plane by the adductor group. The synergist is the pectineus, and the antagonist is the tensor fasciae latae. The right tibiofemoral joint is extended 0 degrees in the sagittal plane by the quadriceps muscle. The synergist is the sartorius, and the antagonist is the biceps femoris. The left tibiofibular joint is flexed 40 degrees in the sagittal plane by the biceps femoris. The synergist is the semitendinosus, and the antagonist is the rectus femoris. The left tibiofibular joint is also internally rotating in the transverse plane by the semimembranosus. The synergist is the popliteus, and the antagonist is the biceps femoris.